Do you wake up in the morning and notice, even before looking at the clock, that your mouth feels completely parched? It can seem as though every trace of moisture disappeared during the night. Your tongue may cling to the roof of your mouth. Swallowing feels difficult because there is almost no saliva present. If this sounds familiar, it deserves attention. What many families dismiss as a small inconvenience, or simply another consequence of aging, may be neither insignificant nor normal. Over more than 2 decades of work focused on senior health, this symptom has repeatedly appeared before serious medical complications. The damage rarely arrives all at once. Instead, it develops gradually and often goes unnoticed until significant harm has already occurred. A 2022 review published in the Journal of the American Geriatric Society reported that persistent dry mouth, known medically as xerostomia, showed a 61% statistical association with 4 major health threats affecting adults over 60. These included aspiration pneumonia, systemic infection, progressive malnutrition, and medication toxicity. Together, these conditions contribute to hundreds of thousands of hospital admissions each year. All of them can be linked to the symptom many people experience upon waking. Consider the experience of Alicia, a 60-year-old retired receptionist living outside Texas. She spent 3 decades caring for others and never wanted to create difficulties for anyone around her. When she began waking every morning with such severe dryness that she kept water beside her bed simply to speak, she told no one. She assumed it was a normal part of growing older. For 18 months, Alicia started every day the same way. Throughout those 18 months, her body continued sending warning signals. Her weight began falling without effort. 1 pound disappeared, then 2 more. Eventually, her daughter noticed that her clothes no longer fit properly. Eating dry foods became increasingly difficult. A chest infection arrived in the spring. Another followed in the fall. Then another appeared during the next winter. Each episode resulted in antibiotics. Each time she returned home. Yet no one asked the question that should have been asked. Why was she experiencing repeated chest infections? The 3rd hospitalization changed everything. One Tuesday morning, Alicia woke unable to breathe. Her lips carried a faint blue tint. Her daughter called 911 while trembling with fear. Her oxygen saturation had fallen to 81%. A healthy adult is typically at 95% or higher. The diagnosis delivered by the pulmonologist shocked her daughter: severe aspiration pneumonia. The condition had not formed over a few days. It had developed gradually across many months. The explanation is important. Every night while Alicia slept, bacteria from her dry and unprotected mouth were being inhaled into her lungs in microscopic amounts. This process is known as microaspiration. It occurs during sleep in everyone. In a healthy mouth, saliva helps neutralize bacteria before they travel farther into the body. Saliva contains immunoglobulin A and lysozyme, substances that function as part of the mouth's immune defense system. Alicia no longer had that protection. Because her mouth remained chronically dry, that natural defense barrier had effectively disappeared. For 18 months, bacteria entered her lungs night after night while she slept, completely unaware of the process. The result was devastating. She spent 19 days in the intensive care unit. She required intubation. The damage to her lungs became permanent. During those 19 days, Alicia's daughter Linda reviewed her mother's medical records. What she discovered was troubling. Alicia had been taking 5 medications for 6 years. Yet no physician had ever conducted a review of how those drugs interacted with one another. 3 of the medications belonged to a category known as anticholinergics. One was prescribed for blood pressure. Another was an antihistamine for allergies. The third was used for bladder control. These medications are among the strongest suppressors of saliva production used in modern pharmacology. Her dry mouth was not merely an inconvenient side effect. It was a warning signal her body had been sending for years. This situation was not simply bad luck. It reflected a broader problem affecting roughly 30% of adults between ages 65 and 75, and nearly 40% of individuals older than 75. One important fact often overlooked is that saliva does far more than assist with chewing food. It is among the most biologically complex fluids produced by the human body. Saliva contains more than 700 proteins, enzymes, and antimicrobial substances. It serves as an immune defense system for the mouth. It helps initiate digestion. It also protects the tissues lining the throat. A 2021 study from UCSF involving more than 12,000 older adults found that participants with confirmed dry mouth were 2.88 times more likely to require hospitalization for respiratory infection within 24 months. That represents nearly 3 times the risk associated with a symptom many people ignore before finishing their first morning coffee. Another concern involves medication combinations. The danger is often greater than most people realize. More than 500 medications used in the United States list dry mouth among their possible side effects. Many commonly prescribed medications can reduce saliva production. Blood pressure treatments, antidepressants, antihistamines, diuretics, bladder medications, and sleep aids are among them. Research published in the Journal of the American Dental Association in 2023 revealed an important concern. When older adults take 3 or more of these drugs at the same time, the impact is not simply additive. The reduction in saliva output becomes magnified. 3 xerogenic medications do not necessarily create 3 times the dryness. In some cases, salivary gland suppression may become 6, 7, or even 8 times stronger. This phenomenon is known as the compounding xerogenic effect, yet discussions about it are rarely included during medication reviews. Another consequence of chronic dry mouth is malnutrition, even in people who continue eating regular meals. Many patients find this surprising. Saliva activates the digestive process from the very beginning. It contains amylase, which starts breaking down carbohydrates while also sending chemical messages that prepare the stomach to release digestive acid. When saliva becomes insufficient, those signals weaken. Nutrients may move through the digestive system without being fully absorbed. A Mayo Clinic investigation from 2022 reported that 44% of seniors diagnosed with unexplained malnutrition also had clinically significant dry mouth that had never been recognized as a contributing factor. Someone can consume 3 meals each day and still experience gradual undernourishment. Dry mouth also creates conditions that allow harmful bacteria to move beyond the oral cavity and enter other parts of the body. The mouth contains approximately 700 species of bacteria living within a carefully regulated environment, maintained by saliva. When saliva levels fall, more dangerous organisms gain an advantage. Streptococcus mutans, Porphyromonas gingivalis, and Fusobacterium nucleatum can increase rapidly within weeks. Research published in Nature Reviews Microbiology during 2023 reported that these bacteria do not remain confined to the mouth. They can pass into the bloodstream through microscopic breaks in gum tissue. Studies have linked them directly to infections involving heart valves, worsening diabetes, faster cognitive decline, and sepsis among vulnerable older adults. Another important point is that dry mouth is rarely an isolated problem. In many cases, it serves as a signal that a deeper condition remains undiagnosed. This leads to 7 warning signs that deserve careful attention because they are often overlooked. The first warning sign is ammonia-like breath, accompanied by oral dryness. If morning breath carries a metallic or chemical odor instead of ordinary stale breath, it may indicate a problem involving kidney function. A kidney function panel should be requested. The second warning sign is thick, stringy, or foamy saliva. In this situation, saliva is present, but its characteristics have changed. This pattern may point toward autoimmune disorders, such as Sjogren syndrome, lupus, or rheumatoid arthritis. An autoimmune screening should be considered. The third warning sign is dryness that appears only during the night. If saliva seems normal throughout the day but mornings are consistently severe, sleep apnea may be responsible. The airway can partially collapse during sleep, forcing prolonged mouth breathing for many hours. A sleep study is recommended. The fourth warning sign combines dry mouth with frequent nighttime urination. Together, these symptoms may indicate diabetes. Elevated blood sugar removes water from body tissues, including the salivary glands, while also increasing urine production. A fasting glucose test and an HbA1c assessment should be requested as soon as possible. The fifth warning sign is dry mouth accompanied by dry, gritty eyes. This combination is considered a classic indicator of Sjogren syndrome. The condition affects an estimated 1 in 70 women over 60 and remains significantly underdiagnosed. Treatment is available, but without recognition, it may eventually affect the kidneys, lungs, and nervous system. The sixth warning sign is oral dryness occurring together with cramps in the legs or feet. This pattern can indicate a serious electrolyte disturbance. Low sodium, potassium, or magnesium levels are especially concerning for individuals taking diuretics. An electrolyte imbalance combined with dry mouth can trigger cardiac arrhythmia. Medical consultation should take place within the week. The seventh warning sign is dry mouth that begins within 90 days after starting a new medication. This may be the body's indication that a comprehensive polypharmacy review is needed. Consider the experience of Robert. He was 68 years old, a retired firefighter from Atlanta, who spent 31 years entering burning buildings. When dry mouth started waking him every morning, he responded the way many tough individuals do. He ignored it. 2 years went by. Then tooth pain appeared. During an examination, his dentist, Dr. Simmons, looked inside his mouth and paused before speaking. 8 teeth had been severely damaged by aggressive decay over a period of 14 months. She had encountered destruction at that level primarily among radiation patients. Dr. Simmons began asking questions. She discovered that Robert's acid reflux medication, combined with his blood pressure diuretic, had removed protective moisture from his mouth for 2 uninterrupted years. The damage to his teeth was not the most concerning finding. She ordered a bacterial culture. The results prompted her to immediately reach for the telephone. Robert's levels of oral Streptococcus mutans were among the highest she had observed outside a hospital setting. A Johns Hopkins study published in 2023 followed 8,400 men between the ages of 65 and 75. Researchers found that elevated oral Streptococcus mutans levels were associated with a 34% higher risk of a major cardiac event within 18 months. Further evaluation by Robert's cardiologist identified early arterial inflammation. His medications were adjusted. The dry mouth received treatment. Today, Robert is doing well. However, he was estimated to be only 6 months away from a possible cardiac event. A dentist asking the correct question about dry mouth may have changed the course of his life. The first 90 days represent the period when anticholinergic suppression typically reaches a clinically significant threshold. Do not postpone action until a future appointment. There are 7 practical measures that can be followed. Begin with a morning assessment of the mouth. Before drinking anything, spend 60 seconds paying attention to several details. Check whether saliva is present. Notice if it appears thin or thick. Determine whether any chemical odor exists. See if swallowing is possible without water. Repeating this every day creates useful information that can be shared with a physician. The next step is a complete medication review. Write down every product being taken, including prescriptions and over-the-counter medications. Examine each one for terms such as anticholinergic or xerogenic. Then tell your physician, I would like a formal polypharmacy review focused on my combined anticholinergic burden. Using those exact words can significantly change the discussion. The third step involves understanding that water alone does not solve dry mouth. Salivary glands require electrolytes such as sodium, potassium, and bicarbonate in order to produce saliva effectively. Large amounts of plain water may dilute those components even further. Small amounts consumed regularly throughout the day, combined with foods rich in electrolytes, are generally more helpful than drinking a large glass before bed. The fourth measure focuses on protection during the night. Raise the head of the bed by 4 to 6 inches using bed risers rather than extra pillows. Use a cool mist humidifier and maintain humidity between 40% and 60%. Choose a xylitol-based rinse formulated for dry mouth. Avoid alcohol-based products immediately before sleeping. The fifth step is stimulating saliva production. Chew xylitol gum after meals. Use sour, sugar-free candy to activate the parotid glands. Include crunchy raw vegetables with each meal. These approaches are simple and supported by clinical evidence. The sixth step is preparing for a conversation with your doctor. State the following clearly. I've been experiencing chronic xerostomia affecting my sleep, nutrition, and swallowing. I'd like to discuss whether my medications are contributing and request a salivary gland function assessment. Clinical terminology often leads to a more focused medical evaluation. The seventh step involves recognizing emergency warning signs. If dry mouth occurs together with difficulty breathing, go to the emergency room immediately. White patches inside the mouth require contacting a physician the same day because oral candidiasis may be present. If dry mouth appears alongside sudden confusion or weakness, call 911. If chest pain or a rapid heartbeat develops together with oral dryness, call 911 without delay. If unexplained fever accompanies dry mouth, seek urgent care that same day. Many people wonder whether dry mouth is simply a consequence of aging. The answer is no. Clinically significant xerostomia is most often associated with medication use, an underlying medical condition, or a combination of both. The statement, "It's just aging," is not a diagnosis. It is a dismissal. Patients have every right to ask additional questions and seek a more complete explanation. Another common question involves hydration. Can drinking more water correct the problem? No. Dry mouth results from impaired gland function rather than a simple lack of fluids. Adding more water does not repair a malfunctioning salivary system. Individuals who wear dentures should also recognize the risk. In some situations, the danger may be even greater. Without adequate saliva, bacteria can aggressively colonize the area beneath denture bases where they contact gum tissue. Natural teeth are not required for dry mouth to create serious effects throughout the body. Now, return to Alicia's story. Her experience did not end in the intensive care unit. After 19 days, she returned home weaker than at any previous point in her life. Linda returned home with a plan. She carefully documented everything, every symptom that had been overlooked, every medication involved, every missed interaction. 2 medications were adjusted. 1 medication was discontinued completely. Within 6 weeks, Alicia's dry mouth had nearly disappeared. Within 3 months, she regained 7 of the 11 pounds she had previously lost. Today, Alicia volunteers at a senior center 2 afternoons each week. She distributes a laminated card created by Linda. Printed in large letters are the 7 warning signals. More than 200 copies have been given away at no cost. Whenever someone accepts one, Alicia repeats the same message. "I thought it was nothing. It almost killed me. Please don't make the same mistake I did." Dry mouth may appear minor at first, yet the stories of Alicia and Robert show how easily an overlooked symptom can point toward a much larger problem. Pay attention to the warning signs. Ask questions. Review medications carefully. Take action before a small symptom becomes a major crisis. If this information was meaningful to you, share it with someone over 60 who may benefit from hearing it. One conversation at the right moment could make a life-changing difference. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.